Joining us now to talk about some of the latest COVID-19 headlines, Dr. Ann Liu with Stanford Health Care. Doctor, thanks for joining us.
Thanks so much for having me on.
So Novavax filed a request for emergency use authorization of its COVID-19 vaccines. This one protein-based. So how does that technology work? How is it different from the mRNA vaccines?
So the Novavax vaccine is called a protein subunit vaccine. It is essentially a little piece of the virus. It's the spike protein, in fact, and it takes longer to manufacture than mRNA vaccines, and so it's taken longer to get to where it is now. But it shows your body a little piece of the virus that can't replicate. It can't cause an actual infection, but it's enough of the virus that of the spike protein that it stimulates your immune system to form a memory response. And so it also comes along with what we call adjuvants, which are things that are added to tell your immune system that this is something to pay attention to, this is something to form a memory response to, so that your body just doesn't think, oh, this is nothing I need to worry about. And so that way, and so you might have some side effects, your arm might be sore, as your body is mounting this immune response to form a memory so that the next time it sees the spike protein, possibly on an actual virus, that it knows to attack it and get rid of it. So it is different from the mRNA vaccines, because the mRNA vaccines essentially provide like an instruction pamphlet for your immune system, for your muscle cells to make spike protein briefly. This is not something that sticks around long at all. And your muscle cells get this little instruction manual to make spike protein that then disappears after a little bit, but just enough that your immune system gets a chance to take a look at that spike protein and form a memory response against it. None of them contain any live virus. You can't get an actual infection from any of the currently FDA authorized vaccines. So, so if you have symptoms afterwards, it's not because of an actual infection, but it's from your immune system forming its adaptive response, and it's appropriate.
So do you think, just a quick follow-up, do you think this is the way we're going to be going in terms of vaccines, if it's more effective?
So we don't know yet if it's more effective comparatively. So there's data to look at differences in the antibody levels, but that doesn't translate necessarily into directly into vaccine efficacy. So more to follow on that. It does look like it is a very effective vaccine from what we've seen so far after 2 doses that are 3 weeks apart, but especially after a 3rd dose that is several months later. So more to follow on that. It does have the advantage of being pretty stable at refrigerator temperatures, and so it doesn't need to be frozen the way mRNA vaccines do, which should make distribution and the logistical part of getting it into people's arms much easier. I think it's going to be a good option for people who can't get an mRNA vaccine for whatever reason, or are hesitant about getting the adenovirus vector vaccine, which is the Janssen or Johnson & Johnson vaccine.
Yeah, that's a big plus. All right, some public health medical professionals recently wrote an op-ed that pushing for an end to all COVID restrictions in schools. What's your feeling on that?
I have heard from some folks at UCSF that does not represent, many of the people at UCSF in terms of wanting to relax restrictions to that degree, where I think that they call for dropping a lot of pretty much all restrictions. And, whether or not I agree with it is another matter, but I can tell you about the concerns that I've heard from families, from patients, families of children who have speech and language development issues might feel that the benefits of removing masks outweighs the risks of COVID. But, we have a lot of patients, adults and kids, who have immune system problems. And, I think that they're pretty terrified of the possibility that people will take masks off indoors. So we really do need to balance all of these different priorities. I personally think that indoor masking is still safe, but outdoor transmission is really uncommon. And so we should try to prioritize being outdoors, getting people together. We're not, staying at home anymore, getting together and having our masks off outdoors to the extent that we can, but also maintaining some masking indoors.
All right, I wanted to ask you about this because Governor Newsom recently talked about releasing an endemic plan sometime soon. Your thoughts on being closer to an endemic stage, at least regionally, maybe?
The endemic state is really reached when there's a pretty stable, predictable, and hopefully manageable level of infection. It doesn't mean that there's so many cases that the virus is just everywhere. That's not what endemic means. I do not think that we're at an endemic stage, although case rates are declining. They're still really quite high, even in the Bay Area. And although many people have now had Omicron, the return of some infection prevention measures has probably contributed significantly to the reduction in cases. And so I don't think that we are at the point where we can declare victory yet. So even of an endemic kind, the next new variant may be around the corner, and we don't know that our vaccines will continue to work against those new variants. So, to be determined. I think that we can be cautiously optimistic as cases come down and adjust the degree of infection prevention measures according to how much virus there is in the community.
Okay, so I think people do hope we do get to this endemic stage, as you say, and we know the threat isn't gone. But so how do we then live with the virus? Masks going to still be a thing, at least for some, maybe from now on, or as the cases ebb and flow?
I hesitate to make any predictions. It has so much to do with how many cases there are, what the next variants will be like, whether they will be more severe or less severe, and will they be blocked by the vaccinations to some degree, and also what therapies that become available for people who do get sick, and how good they are and how available they are. So, I think that there are reasons for optimism. We're in a really much better position than we were in spring of 2020 or spring of 2021. So hopefully this spring will bring more togetherness and more time together, and hopefully getting to a point where we have a good sense of how to control this in high-risk situations and with high-risk populations.
And I guess we have to look at the situation now and say, well, yes, Omicron, it does spread more rapidly, but because of the vaccination rates and other factors, people aren't getting as sick. So, but we don't know that, is what you're saying about maybe the next variant or the one after that.
Right. And, something to keep in mind is that the Omicron variant is overall less severe, but that's, putting together people who are vaccinated and people who are unvaccinated. And so in people who are vaccinated, it is substantially less severe. In people who are unvaccinated, it's somewhat less severe. And, and I think we all know people who have had Omicron who had no symptoms, who had really mild symptoms, which is hopefully the majority of people who are vaccinated. But, we also know people who are fully vaccinated, boosted, and still got really pretty sick. So, and then people who have immune system issues, who are a substantial segment of our population, may not produce any response to the vaccination, and even if fully boosted, remain at risk. So, we still have a lot to do, but we have a lot more tools at our disposal now.
We do. We're grateful for that, and we're grateful for your time, Dr. Ann Liu with Stanford Health. Thanks so much.
My pleasure. Have a great day.
All right, you too.